For therapists, there are artistic and scientific decisions about how much to share about our own experience, about psychological knowledge, and when to follow the client's lead. I wanted to say a few words today about how much to listen and follow the patient, and how much to decide to intervene and teach and direct the client as they go through their session. Carl Rogers and person-centered therapy advocate that it's the therapist's job to follow the patient. And the notion is that by following the client, the therapist will help the client find their own inner solutions and resolution to their difficulties. This can be a fantastic way to help clients in therapy find solutions to their problems, make meaning and sense of their lives, and feel like they're having productive counseling sessions. At the same time, there are certain circumstances where it's appropriate and even essential for the therapist to be more directive and involved. For example, during crisis counseling, it's really important for a therapist to be able to come in with expertise and direction and explain to a client why certain things should happen in a certain way and order, and what needs to be thought about. This could be about assessing something dangerous like suicide, where a therapist needs to be very clear and directive in keeping people safe. And thirdly, I would say it also happens when it comes time to what's called psychoeducation, that a client is asking or talking about an issue that the counselor happens to know a lot about. Being a therapist involves both knowing the science about how people work and what psychological research can show us, but also the artistry of the therapist choosing and determining how to intervene and how much to share about themselves in certain situations.